Hello, everybody. I am thrilled to have this very much needed dialogue on what is new with COVID. My name is Melissa Elmira Yangst, and I will be moderating this discussion with these three experts in the field. Before we go on, I would like everybody to go ahead and introduce yourself and what your field is. We'll start with Ian.
Sure. My name is Ian DeAndrea-Lazarus. I'm currently a medical student at the University of Rochester. I'm a dual degree, MD and PhD. And I also have an MPH, a Master's in Public Health, and a co-founder of Deaf in Scrubs. You can find us on Facebook and Instagram.
Wonderful. Thank you. Torey? Torey here. Yes. Hi, my name is Torey MacPherson. I just graduated medical school, and now I'm doing a residency in southern New Jersey. And
Hi, I'm Chris Moreland. I'm a doctor specializing in internal medicine. So I work with adults, and primarily I work as a hospitalist. So working in the hospital here in Austin, Texas. And I'm also faculty with a medical school at the University of Texas at Austin, teaching medical students and training doctors.
Wonderful. Thank you for the introduction. I know that there's going to be a lot of questions in regards to this topic. I thought we would open up with, how have you seen COVID evolve in the past almost 2 years now? What is the latest with COVID in your field of work? This is Torey. The main difference that I'm seeing is age. I am seeing a lot more kids, less older adults, and there's a lot of kids with complications.
I think that with the Delta variation, it's given the virus to be the ability to be more transmissible. So it spreads faster from one person. It can spread to more people than before. So the transmissibility has increased and created a more severe situation than was in the past, where more people are becoming sick and having to be hospitalized and be intubated. And, so I think that's more opportunity for people to pass away from the disease as well. Dr. Moreland says, last year when it first came up, we didn't know what to do with it. We weren't sure which medicines were the right treatments that would work, which ones wouldn't. Lots of research has been happening very quickly. And at this point, we're in a much different place. We've got protocols in place. We've got strategies for treatment and prevention, in how to, distance people from other patients and still allow contact and communication access for people in the hospital. I think now that our treatments for people with COVID are much better and safer, we're able to catch more people outside of the hospital and keep them out of the hospital so they can recover at home, so they don't become severely ill and come in. So our science is better. It's working more effectively at this point.
Wonderful. One question I've seen pop up often from the audience is, what is the difference between COVID-19 and the Delta? And is the Delta part of COVID-19, or is it a completely new disease? I think a lot of people aren't understanding that. And now with the Mu, I think a lot of people want to know, what is the difference between each of these?
Yeah, I can take this. I think the impact is that it's a normal behavior of a virus, actually, that we're seeing. Viruses mutate over time, and they need to mutate in order to survive. So their goal is to infect as many people as possible and to create more virus, so to replicate themselves. And so what happens is, when somebody gets sick with the virus by mistake makes a copy of itself, and then that copy then becomes beneficial to the virus. It wasn't intentional. It was a mistake that happened in the copying, but it becomes more transmissible. It can transmit faster. And so the body's systems have to work harder to eliminate that virus from their system. And so Delta is a type of COVID-19. It's a mutation. It's the same virus. It just has extra mutations in it that are beneficial to the virus spreading in how it competes against the other varieties of the same virus. So the other one spreads slower, this one spreads faster, which means it kind of takes over. And the other ones kind of die out because of treatment. And now with Mu coming up, it's going to compete with Delta. Mu has a few mutations that might be advantageous to it for people who've been vaccinated. We really don't want that to happen. You know, these are from lab studies. We haven't really seen it in the communities yet. So we haven't seen that show up in patients yet, but it's something we're looking out for. So our concern is Delta at this point, and we're looking out for Delta.
Okay, thank you for explaining that. Now, is it worth to get vaccinated if the original goal of the vaccine was to fight against COVID-19, but now we have the Delta, we have the Mu? Is it worth to get the vaccine, or should we wait to get something that might prevent against all of the mutations? Mrs. Torey speaking, I think it's important to get the vaccine because if you do get COVID, your symptoms are a lot less severe. You are protecting kids around you who can't get the vaccine or other immunocompromised people who cannot get the vaccine. You are protecting them, and you're lessening the likelihood of them getting.
This is Dr. Moreland. I definitely agree with that. The vaccine we've seen is fantastic in the history of vaccines, how fast it's been developed in less than a year and been able to be put out in the community. It's a quite good vaccine as far as vaccines go. The concern is it going to work with Delta but it's still COVID. So it's a COVID vaccine. So a new strain that's come up, like was explained, the Delta variation, COVID vaccine still works on it. It's still very good at preventing and preventing death and saving people's lives and keeping people out of hospitals, which means if you're vaccinated, your likelihood of catching COVID means that if you do get it, you'll just stay at home and recover there. And it also severely reduces the risk. So the vaccine definitely helps. If you do not get vaccinated, you're increasing your risk of being hospitalized from getting COVID. I've worked all over the United States, and I've seen hospitals all over where most of the people who are in the hospital with COVID infections are those who have not been vaccinated. And so, yes, I highly encourage everyone to get vaccinated. It is very safe. We've now been looking at Delta, and the vaccination has been safe for people for about a year now. So I really recommend that.
This is Torey. I wanted to add one more thing. There's a lot of misinformation that is going out there. And what we're seeing is that 96% of doctors got vaccinated. We would not get vaccinated if we did not think it was safe or effective. Melissa here. So you work in the hospital. Are the hospitals actually filled to capacity like the media is saying it is? Some people think it's not true. They're not believing that the hospitals are full at capacity. But what you are seeing day in and day out, are they full?
Torey, you want to respond to that? Go ahead, Torey. I'll let you respond first.
Yes. So I work in Southern New Jersey, and it's not as bad here. The Northeast has better vaccination rates. The South is a lot worse currently, and the Southeast, I'm sure others have more to comment. Chris?
So yeah, in Texas, we've had a huge impact in increasing cases over the past couple of months. So it's gotten pretty bad. For example, many hospitals in the Austin area are full. Our ICUs are overwhelmed. Just recently, in the past week or so, we've realized that the Central Texas area has had no ICU beds for 1 or 2 days now. The hospitals may have other beds available that are not in the ICU, but regular beds, but they're getting full. The emergency room has a large number of people in their waiting rooms frequently. And so we seem to be at the peak right now. We're hopeful that we're at the peak and we're going to start to see some decline. We really hope that happens.
Yeah, for Texas, that is accurate. New Jersey is expecting to have another peak within October. It's not that bad here, but we think we'll have another peak. This is Melissa. Why is New Jersey expecting an increase? Well, when we say peak, peak is the highest rate, and that's going to hit about October. It really just depends on the trends that we've been seeing and how fast the spread has been in each state, how many have been vaccinated. The more vaccinations, it's the less we see the infection rate, and we're not seeing it too bad here. We're also seeing an increase in drug overdose, alcohol, psychiatric patients. And this is because a lot of people are having problems with anxiety, depression, alcohol abuse because of the pandemic. And so COVID cases, we're not seeing a peak yet, but we have been seeing a peak in these other cases.
Well, if I could add to that, in the Austin area, hopefully we're at a plateau and that we're going to decline. But our concern is also with schools being open now for the past couple of weeks, that now that's the chance for another peak to be coming. And we're concerned about COVID infections with the hospitals being full and backed up, which means that also other people who are having other medical issues, strokes, car accidents, and other things not related to COVID are going to struggle to get care because there's no room in the hospitals to care for them. And so the COVID issue is a challenge for everyone, not just for the people with the COVID infection.
I want to go back a little bit and talk a little bit more about the strain. We received a Facebook question. A lot of us are concerned about the mu variant now. Is it true that we're going to have more and more different variants? Will we have a different kind after the mu and a different kind after that?
Well, that is expected, again, because that's normal behavior for a virus. So we will see other strains coming up, but our hope is that as they come up, they'll be weaker. Maybe they'll be more transmissible, but they'll be weaker, not as fatal. It could go that way. And that's what we're really hoping, that people get vaccinated, because as people become immune and as enough people become immune, then the virus has a much harder time finding hosts to infect. And when that happens, then the virus has to mutate to become more transmissible. So then it can find more people to infect. And what that happens, it tends to become weaker. So it becomes more like a cold where you're out socializing with people, but it's so weak. So that type of virus happens. It's not the fatal virus that, kills people quickly through, that transmits fast as well. Now, it is possible it could go that direction, but we're really hoping to avoid that by having people, acting now to reduce transmissibility, reduce the risk of those mutations coming up later. Let me just add to that. When you think about the grass in the forests out there, if you're not vaccinated, that's like, it's easy to get through the grass, right? And run through the grass. But vaccination makes everybody a tree. And the more people that are vaccinated, the more trees in the forest. So the virus has a hard time running fast through the forest and being able to find people to infect. So if we're all vaccinated as much as possible, it's a dense forest that protects ourselves and each other.
That's a good comparison. Now I can really have a better visual of how the virus searches and attacks. Now, for me, I got the vaccine, but yet I can still get COVID and I can still spread COVID. How does that work exactly?
Yeah, so the risk is still low. So breakthrough rates are very low among the vaccinated. One recent publication mentioned that the breakthrough rates are about 0.02% for people who get fully vaccinated. So it's a very small percentage of people. So that's the first thing I would say. It can be spread by unvaccinated people primarily. But immunocompromised people who can't get vaccinated, they don't respond well to vaccinations, or older people who have weak immune systems don't respond well to those vaccinations and things, it's going to continue to show up in them. But hopefully they won't have to go to the hospital. But to reduce the spread, that's why we're encouraging masks as well, because if we don't have I have the virus and I'm not wearing a mask, then I could spread it to somebody who couldn't have the vaccination and they could die. So we're trying to reduce that. So getting vaccinated is a small chance you'll get it and transmit it, and then the mask helps cover those with that small percent chance of transmitting it.
I'm happy you touched briefly on the mask part, because that was my next question. A lot of people on Instagram and Facebook have asked that if I got the vaccine, I don't have COVID, then why do I have to use a mask? Like Ian said, if you have the vaccine, you can still get the COVID virus into your body, but you might not get infected, which means that you're a carrier and you're passing it to other people who didn't get vaccinated or couldn't get vaccinated for whatever reason it was. So the point is that you don't want to be able to contract the virus and be a carrier and spread it to others. Now, I want to make sure that I understand you correctly. I'm vaccinated. So I could be a carrier of COVID without actually being positive for COVID. Is that correct?
So let me answer this. The COVID test, when you're positive in the infection, are two different things. So with the vaccination, I can still acquire the virus and pass it on to other people. If I were to get tested for COVID while I'm passing it, transmitting it, that test may show positive. It doesn't mean that I'm going to get infected, however. Or maybe I get a COVID test, maybe my work requires a COVID test before I go into work or to another place. So I feel fine and I go get tested and it comes back positive. Does that mean I'm going to get sick? Maybe, but maybe not. So a positive COVID test is different from the infection. And I agree that a vaccination, there is some evidence and research suggesting that the vaccination reduces the risk of transmissibility as well. So we're still looking at that data. But I certainly agree that protect ourselves with the vaccine and with a mask are two of the most powerful weapons that we have against the COVID virus. Yeah, if I could chime in on that. Your immune system, your IgA, you've got two different types of Ig antibodies, IgA and IgG. IgG is what is in your blood circulating all the time. So when you get vaccinated, that causes that to increase in your bloodstream. When you get COVID, then you've got IgA in your mouth, in your membranes of your mouth. And the test is in those membranes. So the virus can be in those membranes, but your immune system, which is in your circulation system, prevents you from getting infected. But you still could have it in your membranes and have COVID virus in your membranes there. So when you get vaccinated, and then you get a COVID test, it's an IgA response. So there is still a possibility of you passing COVID just because you've got it in your respiratory system, upper respiratory system.
Okay. Well, let me go to a different topic. I've noticed that there's more and more nose tests. I know that there were some using the mouth test, but it seems like the trend is to more to have the nasal swab. Is the nasal swab more reliable than the mouth swab? So the virus is found more often in your nose. Okay, well, that's a simple answer there. Now, masks. Do you think the mask mandate is here to stay for a long time? After maybe COVID settles, you think that they're still going to continue a mask mandate and it's going to be part of our everyday norm? Mrs. Torey, I think that's a wonderful question. I think that at least in the education system, at least. But in the everyday life, I just don't know. And can you clarify what's ED? Well, I'm sorry. ED is emergency department. Masks are here to stay. And it's weird that we didn't before, to be honest with you, but from here on out, we will be using masks. Other than that, I do not know.
It does remind me of when surgeons used to not wash their hands because they didn't think it was necessary. And now they realize, wow, washing your hands is critical to help prevent infection in our hospitals. And so now I think maybe we're having that moment with masks, that masks will be more of a permanent fixture in doctor's office in the hospital setting. Yeah, I think for a long time we're going to see masking out there. Hospitals, doctors' offices, in our primary care system, places of high risk for COVID transmission. I do think that may continue out there in public in some places, maybe not easy to predict that. So, as long as we go and get vaccinated as much as possible, I think that our risk of having to wear a mask in public reduces based on that vaccination rate.
Now, in regards to vaccines, I've seen a lot of questions about or comments about vaccination injuries. What is the true number in regards to vaccination injuries? Is it something that somebody should avoid if they do have another condition, like a cognitive condition, that they shouldn't get the vaccine? Would you recommend that those categories of people wait? And are people really getting hurt from the COVID vaccine?
So, some comments. The risk of injury from the COVID vaccine is very, very low. The injury is just a pain in your arm, basically. That's it for the most time. And the first shot, it didn't hurt much. And then the second shot, I was sore for a couple of days, but it was certainly worth it. And often people do experience feeling a little bit of a fever or some chills, maybe some nausea and diarrhea, maybe some vomiting. They feel lousy for a couple of days. That happens often with vaccination, but that's not dangerous. That's not a sign it's dangerous. Those symptoms go away quickly. It's not life-threatening, certainly. Some people have expressed a concern about other possible things. Low platelet count. Those are some of the cells within your blood, maybe that impact clotting. So if you're having surgery, platelets help stop the bleeding quickly with blood clotting. People are concerned that maybe they're noticing a very, very few people have had that as an issue come up with certain vaccinations, or there's concerns with possible blood clotting and a clot maybe going to the brain or another part of the body. But with a specific vaccine, they've done a lot of research, and the risks of that, if those are associated with the vaccine, are still very low. But those risks, are there, but they're so low. I don't remember the exact numbers. I don't know if somebody has them, but 1 out of several million people.
Oh, that's low.
And other possible reactions could be maybe there's an allergic reaction. Some people are concerned about that. That is also extremely rare. Some people are worried about a certain syndrome, GBS, where the nerves in their body, they have a certain reaction to the nerve problems, and it creates some weakness in walking and things. That has been a concern with the vaccine. It has been studied with flu vaccines, the COVID vaccine, and others. Even in 2008, 1998, there were things that would happen with vaccines, but the risk for that was about 1 in 50,000. So it's a very low risk situation. As far as with dangers with the COVID vaccine, they're so low. I haven't seen much of a problem with them. In addition to that, with GBS, it can happen with the infection itself, not just with the vaccination. And so my point really is that it's very safe. When a vaccine becomes available for my children, I'm ready to vaccinate them immediately. And if I'm comfortable vaccinating my children, I believe that it's safe.
So I heard this from somebody, and they said that this vaccine is not new, and it's been years in the making already. It was an interesting fact to hear, and it was from a from a scientific perspective. Can you explain what that actually means?
Sure. Yeah. So this mRNA vaccine has been studied for many years. We've known about mRNA since the 1960s. Use in a vaccine as an idea and a concept was there in 2005. So a lab did some research on it on how to make it work in a fat bubble. to get the mRNA last long enough to go into the body and to be able to teach the immune system what the virus looks like so that it can be prepared and ready to respond. So when COVID came onto the scene, the mRNA was modified and sequenced from COVID RNA, and they found the place that creates the spike proteins that are on the cell that are that go into your body. And then your body can recognize that spike protein from what it's been taught from the mRNA vaccine. Your body learns what that looks like. And so once the virus comes in, it's easy for your body to recognize that and destroy it. So it is not a new concept.
Thank you for clarifying.
Some people have asked recently, there's like 3 major vaccines, Moderna, Pfizer, and then Johnson & Johnson. So some of them ask me, is there COVID virus in any of them? And what was just explained is no, there is no virus. It's just RNA that was taken from them to help the body recognize those spike proteins, but it's not really a virus itself that's being injected. Well, let me add to that too. It can't infect your DNA, this virus. It's not attached to your DNA or anything like that. So it just comes into your body, and then your body recognizes it, and it's gone within 72 hours.
Thank you for that clarification. I know that we have some questions from the audience. So currently during COVID era, how do I take care of myself, and how do I stay safe? Should I hold off on elective surgeries until after the pandemic has subsided? That's a wonderful question. I think it really depends on their condition and how severe their condition is. If it's something that maybe they could wait for, I would wait. If it's something simple that could be postponed, definitely wait. But if it's something severe like a heart condition, you should probably proceed with it. I think it really depends patient to patient.
Yeah, I really want to encourage people, if they're doubting whether or not they should delay their surgery or go ahead and get surgery done, just have a discussion with your physician, with your primary care physician. They'll talk with you about it. You guys will make a decision based on the risks and benefits of that. It really varies with each person.
That is very true. And some states have the ability to do these elective surgeries, and some do not have the ability currently. That is very true. I see one comment here. It says, Dr. Torey, you brought up a wonderful point about mental health during this pandemic. Do you have any advice for us on how to navigate this time frame? And maybe I could even add, I'm curious how the 3 of you take care of yourself, because I'm sure that this can be very overwhelming for all 3 of you, especially with seeing patients, looking into all the scientific aspects of it. How do you take care of yourself? I've been a huge proponent of working out, meditating, taking care of your health. And I think that those 3 things really help my mental health, and also having a wonderful support system. If you can't hang out with them in person, I feel guilty hanging out with people in person because I'm working with them. So find a way, whether it's FaceTiming or whatever it is. It doesn't have to be in person. And I think all 4 of those things are really key to taking care of your mental health. Thank you for that.
Yeah, I would echo what she said. Dr. Jamie Wilson, a deaf psychologist, provided some good suggestions last year about mental health and taking care of ourselves. It was a nice few ideas. He said, take some breaks during the day. If you're feeling stressed and anxious, take some time just for yourself. It's okay to do that. And I agree with what Torey said. I take time for myself, some things I enjoy doing, like spending time with my family. I do make time to see my friends. We sit outside socially distant and chat. So find a way to get together in person if you can.
And also I want to add that I think that everybody should go to therapy. I think that that's just something that everybody should do for your own good. Yes, absolutely.
Therapy is a great resource for many of us. Absolutely. It can be very helpful for you to, share your feelings and have just somebody neutral you can talk to. I do want to emphasize that social distancing doesn't mean disconnected. you can still be in touch with people, and that helps a lot. Humans need contact, whether that's online or in person. We live in an age of technology where we can see each other on video and FaceTime. We can sit at safe distances and chat. Enjoy, taking those breaks and taking care of yourself. Mental health is physical health. It's an important part of your health. Absolutely.
Thank you for that. Oh,
also, I would say take care of each other. Look out for one another, your family and friends. If you notice somebody's not doing well, just check in with them.
absolutely. This topic, we could go on for hours. Unfortunately, we do have to wrap up, but I have one last question. Every day, we're seeing all different types of news and media stories. What is the best way for us to trust reliable updates? Where should we look to for those updates? I would say the CDC, honestly, is the best group to start with, and also WHO are probably the best ones to follow.
Yeah, for ASL access, we're trying to provide that through Deaf and Scrubs and other resources as well. So there are different sign language resources out there, so you can look to those. Look for things that are reliable and reputable, that are using medical professionals and researchers to describe the information. And then as you're looking at the media out there, some media is not reliable. So I suggest you always go back and check back at the WHO and the CDC's websites to verify those.
And also talk to your doctor if you have other questions as well.
Definitely the CDC and the WHO is where we as physicians get our information. We get our information from them, so we trust them. Information changes. There's new concepts and new things that come up. COVID's taught us a lot over the past year, so we have to trust them. And I think, Docs and Scrubs, is great. It's got good information there as well.
Wonderful. Thank you. I really appreciate your time for sitting down and having this discussion with us. I'm really hoping the audience was able to watch, and feel free to type in more questions. Maybe some of you will be able to type your responses and your thoughts and your comments. Again, stay safe, everybody, and stay aware.
Yes, thank you.
Thank
Stay
for
safe.
inviting me.